Dr. Joaquin Berrón, a highly experienced dental implantologist in Cancun, Mexico, explains some of the top dental procedures performed at his clinic.
The main procedures that we do here is in the prosthetic area, we do a lot of smile makeovers. And that means basically patients that have worn their dentition out or that they want just aesthetic improvements in their smile. We do this full mouth renewal, meaning either with veneers or crowns, and we change completely the appearance of the patients, the smile. That enhances their confidence a lot, their self-esteem, and that's one of the main things that we do, because patients that come to us, usually they don't come for minor procedures. So this is one of the big ones that we do. The other thing that we do a lot of are implants nowadays. Implants have become a major part of our practice, because in the past, without implants, we wouldn't have the ability to restore a fixed dentition on a completely edentulous patient. Nowadays, with implants, we can do that, and we do that all the time. Be it with the all-on-4, all-on-6 protocol. It depends what the patient's needs are and what the patient's conditions are when they come to us. In order to do this, we always go through an intensive study of and diagnosis of the patients. We do, for implants, we always do a CT scan, computer tomography. This gives us the third dimension, and we can do cuts of the areas where we want the implants, so that we can measure the width, the height of the bone, the quality of the bone, and all of this is part of this diagnosis that is so important so that you can have a correct outcome. Those are the two major ones. Then in implants we do a lot of single implants. Nowadays, when you lose a tooth or you lose be it anterior or posterior, it doesn't matter. In the past, the only way to restore a tooth like this was either a fixed bridge or a removable partial. Nowadays, implants gives us the ability to restore that tooth again without damaging the two adjacent teeth, if you're thinking of a fixed prosthesis, or being with the hassle of removing a removable partial, and some patients have that they have to remove, clean, put it back on. Sometimes they're not so stable. So that is a great advantage nowadays with implants. Those are the main things that we do. Of course, we do all the operative and endodontics and all the things that go around these main things. Because if you're doing a full mouth restoration with implants and crowns, so you might need root canals or endodontics, some perio treatment, but that all goes around the main treatment that would be a full mouth restoration, for example.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.